on the same things. Okay. So tonight we're going to kind of teach you a little bit about your spine and the different parts that hurt and why they hurt. And some of it comes from mechanical problems and some of it comes from chemical problems. And we'll teach you some exercises and teach you some little home maintenance things that you can do and how you can better deal with back pain. So, let me figure out where I'm going to start. Let's start with, basically in the lower back, there's going to be three types of problems. Okay? There's going to be the classic lumbar disc. There's what we call a lumbar sprain. And you may have been heard that that's called a facet syndrome. And then the most common of lower back pain involves the sacroiliac. Joint. Right? So, I never forget the Little Rascals when I was a kid, and the old guy in the orphanage had a sacroiliac that used to go out. I remember he was going to tell him, well, when I get my back pension, we're all getting out of here. So he's got to eat mush every day. Remember that? That was my favorite show. All right. So, I'm going to do my best drawings here. And we'll start from the bottom. All right. So we have these are your two big hip bones. Here's your legs coming out. And then there's this triangle that fits in the middle of them. That's called your sacrum. These are called the iliac bones. This joint here is called the sacroiliac joint. Okay? This is the most common area of back problems. Right? This is where it all starts. And it all starts because we were designed to work on four legs and we decided to stand up, and it puts a lot of stress on our sacrum. And your sacrum are these two little bumps you feel right back here. Okay, and when it's hurting, sometimes you'll feel some swelling over there. You may feel like a little nodule. That's a bursa sac that swells up. So, what happens, oh, I shouldn't put the drawing away. Is then your lumbar spine sits on top of there. That's the foundation for your spine. And in between the lumbar vertebrae, we have discs. Okay? And the discs are the shock absorbers. Okay? And weight should kind of sit evenly on there. And however, it all determines, it's all based on the foundation of your pelvis, or your sacroiliac, your sacrum, because your lumbar spine sits on your sacrum. So if one hip is always higher than the other, well then your spine will compensate. Okay? Because what has to happen is when it gets up to your eyes, they have to remain level or your equilibrium is going to be crazy. So one hip will go high and the opposite shoulder will go high, and then your head will tilt to your eyes stay, so you tend to look at somebody. So stand in the mirror when you go home. If you have full length mirror, it's really good. And look and see, does your head tilt like this? Does your shoulder do one of these? Or your hip goes up? Well, usually it's starting from the foundation. Now, to take it one step further, we come down here and we got our little feet. Okay? Very often, chronic sacroiliac and low back problems come from foot problems. Okay? When I was young, I still am young, when I was younger, when I was 16, I started to get sciatica. Okay, and I started to get pain in my pelvis. And my older brother was a chiropractor, and my uncle was a chiropractor, and so I, we get adjusted, and it definitely helped and took it away. But it always kept coming back. And I played soccer. was getting out of college, I took a seminar. I was at chiropractic school. I took a seminar about orthotics, right? And the man was, had made these things called foot levelers, and somebody may have had them. And the chiropractors, they've been around forever. And he was, explaining this. So, it makes a lot of sense. I always turned my foot out. My shoe always wore out on my right side faster. If you look at your shoe, okay, and your foot does one of these where your top part of your shoe ends up going out over the sole, okay, or you look at the corner and you wear out one corner faster than the other, right? You have foot misalignment. So old Monty was like, I was paying the ass and got up there after class. I said, well, you know what? I said, I hear they're all the same. You're just kind of making for the size of people's feet. And he said, well, yeah, they are. He says, well, how many types of level are there? And I was like, there's only one. You're either level or you're not. So what happened is podiatrists would make orthotics and make these rigid, hard plastic things for you. And if you tilt it out, they tilt you in. Okay, and they just throw you into a different distortion. So he says, well, I'll give you a pair. I said, no, it's okay. I'll buy them. I'll try it. It makes a little sense. And I've got these things, put them in my shoes, and in 2 weeks, I had no more lower back pain. Okay, I could go on my feet forever. Okay, I'd take them out of my shoes, and I'd walk from here to the road, and I'd start with lower back pain. Well, I had destroyed all the ligaments in my ankle, and so I always kind of walked on the outside. And so that's where I learned that the majority of mine came from my foot problems. And I still have them in my shoes today. Okay? And so a lot of chronic lower back pain comes from your feet. And there's ways we can test for it, and we even got this high-tech computer scanner that we put you on, and you stand on there, and it shows us just how you tilt out. And people are amazed because they can see it shows which way your body goes, and you can see where your pain side is all the time. So a lot of chronic things, especially if the more you stand, the more your back hurts, a lot of times it's coming from your feet. So that's one real big possibility of where it's coming from. So, we can show you a few tests for that. There's a trick where not a trick, but we use athletic tape and support your arch and retest, and you'll see how strong it is. And so people that wear orthotics know how much of a difference it can make. I cannot live without it. Alright, so getting back to the sacral leg. This is the area of your spine that tends to weaken the ligaments, and it's really big ligaments here. Okay? And they'll tend to, over time, loosen. And ligaments are kind of like sweaters. When you stretch them, they stay stretched. They're not elastic like muscles or tendons. And so they'll weaken. And so they can weaken for a number of reasons. They can weaken from, in simplicity, say, calcium deficiency. Okay? And it's often people that we find that aren't healing, there's a chemical component to it, okay, it's chronically going out. And so check for that. The one thing that Melinda, I've been having this like all day, haven't I?
I know.
Sinuses. I don't know, I'm like names are like, how long have I known Melinda? One of the first person I ever met here when I moved here. Okay. We're talking about prylotherapy. Okay, prylotherapy is a medical treatment that was actually started by osteopaths years ago. And what they do is they inject sugar water into the ligaments. Well, sugar itself is an irritant, it's inflammatory. And so it causes the ligament to swell. Okay? Therefore, it tightens it right back up. And they do a series of like 20 or 25 injections. They're not real comfortable, but sometimes it's a huge improvement for people and really, has some lasting benefits to it. However, I don't like to go there if we can avoid that. I like to strengthen the ligaments nutritionally. One of the things you can do for your sacroiliac joints is to have everybody stand up. This is participation. Sambo, move. I know you guys quit. No problem. Okay. Here's one easy way to realign your sacroiliac joints. Alright, everybody stand up nice and straight. Move your feet about inside of your armpit to the part. pigeon toe. Okay, turn your toes in. Now what you're going to do is you're going to slowly slide down so that your knees come together. And then you're going to push up nice and straight and keep your chest sticking out. Right? And you do that 3 times. Get your shoulders back, stand up a little straighter, push back, squeeze your butt muscles together. And you do that 3 times. So if you're on a long car trip, that'll kind of realign your sacroiliac joints. You can, stop at a rest stop, do that 3 times, and that'll often put it right back into alignment. Another thing, and I forgot to bring that. Maybe somebody has one on. You have a trophy or something?
I have mine in my bag.
Okay. One of the things we use is called the trochanter belt. And the reason it's called the trochanter belt is because you have your hip socket here, and you have the ball that comes in, and it comes out, and there's this little bump fill on the side. They're your pockets. Those are your trochanters. And they're a little higher. So when these ligaments get lax, you can use one of these belts. Okay? And these are mirrors. I use one myself because I have sacroiliac instability. And it kind of goes around your hips. It's a little bit elastic. Okay? And put it on to these 2 little fancy pulls back here to snug it up. And that will hold your sacroiliac joints in place. Okay? Excellent when you do housework, yard work, repetitive movements, mopping, vacuuming, raking, okay, wreak havoc on your sacroiliac joints, because what they do is they allow you to bend forward and backwards. What they don't like is twisting, right? Like in the golf swing, okay? Like shoveling, raking, weed whacking. So these things really help you stabilize your sacroiliac joints. They will make up for ligament laxity that you've developed over the years. They're very inexpensive. They last forever. Okay, but there's something worthwhile to invest in. If you do housework, vacuuming is extremely hard on the sacroiliac joints. Okay, any repetitive movement back and forth. We had a man come in about 2 months ago, and his back just collapsed. He was in excruciating pain, and he crawled in, walked out.
He didn't crawl out.
He's retired and he's building a boat. Okay, and he's sanding all day. Okay, and then that will work it, and then all of a sudden you bend over or you reach across the table. Okay. So when you see that really severe back pain, where people are like this, okay, walking like John Wayne, okay, those are usually sacroiliac sprains. Is 85% of all back problems are in the sacroiliac joint. The other exercise, well, I guess we can show those exercises. I will show all the exercises I know, so let's talk a little bit more about back problems.
Joe, question.
Yes.
You said twisting, then would that be that, like yoga poses like spinal twist and, all those maybe if you're having a problem are not a good idea?
Are definitely not a good idea.
Okay. I should figure
What I found out about myself was we used to do this stretch in soccer all the time. Okay? Some of you guys probably did it in other sports. And you have to bring your leg up and touch your hand.
Yeah.
Right? Every time I did that, my back would clunk. Oh well, I'm young, no big deal. I was like, God, but then I started this back problem inside of it. Well, I found out, some of you guys know I had a horse accident and I broke my pelvis. Okay? So I did a CAT scan. So he tells me, well, your right sacroiliac joint's fused. I was like, well, that kind of explains why it would clunk all the time, because once I would take it past where it could go, well, something else had to kind of like jump out of place so I could accomplish the movement. Right? So those type of twistings are really bad. If you're going to twist, okay, the safest way to do it is to do both legs. Okay, then you're whole pelvis moves at once, you tend to stretching your lower back. I don't like twisting motions because I'll show you why in a minute. We have basically three parts of our spine. We have our lumbar spine, that's our last 5 vertebrae, that's where most discs herniate, okay? Then we have our thoracic spine, that's these 12 vertebrae in the middle, that's where all your ribs are and all your organs, okay? The reason you have a rib cage is to protect all this stuff, okay? And then you have your neck, which are 7 vertebrae. Well, in the lower back, here's what a vertebrae looks like from the side. So we have a square.
Put that the other side of the paper.
No, it's because I used it wet. Dry boards don't like wet stuff. Okay. I picked up the one that was dead. Okay. So now we have the vertebrae, that's the square block. Okay, and we're looking at me from the side. Then you have the part that comes back here and there's a little joint down here. It's called a facet joint. This little spine process should be able to part the back. But the next vertebrae below I didn't line this up too good. These guys fit together like this. Okay? And so then your next vertebrae stacks up here and it stacks. So they have this joint. There's one on each side. Those are called facet joints. And they determine which way the vertebrae can move. So in your lower back, they face this way. And so they allow bending forward and backwards. Okay? They don't like to twist because twisting is what they restrict. So your sacrum doesn't like to twist and your lumbar spine doesn't like to twist. So you don't want to be trying to stretch it that way. You know, stretching a muscle is okay, but if you stretch the joint along with it, that's not, and it doesn't go in that direction, that's when you start to stretch the ligaments, okay? And if we get loose ligaments, then the joint becomes loose, and it becomes unstable, and it wears more, and that's where you get arthritis from, okay? Most arthritis, the most common kind of arthritis is osteoarthritis, okay? Rheumatoid arthritis, you know, psoriatic arthritis, those are diseases, those are chemical diseases. Osteoarthritis is wear and tear, okay? And if your front end of your car goes out of alignment, okay, and you wear off one edge of your tire, all right, that's osteoarthritis. So when these joints get loose and they're constantly like slamming around, they start to develop calcium deposits, you start to wear out the joint lining, and they get bone spurs and things like that and become arthritic. So in your thoracic spine, when the vertebrae fit together, the joints go like this, okay? 90 degrees from the ones in your lumbar. Well, they like to rotate. So all your twisting occurs in your rib cage. Okay? It doesn't allow it to bend forward and backward because you'd be crushing your heart and your bones. Okay? And they need space to be able to move. Your neck vertebrae do a little bit of both. Okay? And they have a completely different type of joint that allows for movement in all directions. Okay, we'll be able to show you some techniques. So I don't like to twist the lower back. If we're going to exercise the sacroiliac joints, next step, I'm going to grab a couple books. We got lift up in the air.
Yeah, think about that.
Lots of music.
Lines up.
Keep walking.
That'll work. We'll get the idea across. Okay. What we're gonna do is you're gonna take a couple books or a step, and we're gonna exercise the sacral actions. In order to do that, it's a movement, and I'll turn around this way, see my butt. And we're gonna lift our hip up and down. Okay? And you have, the reason you're elevated is so your hip can drop below level. Okay? And this is a real fine motion. This is how you exercise the sacroiliac joints. It only moves a couple of inches. And you only do like 5 on each side. Then you step on the other side and lift your hip up and down. It helps if you have something to hold on to. And you're going to see when you do this, one side's easier than the other. And so if you have like a lot of left lower back pain, you'll be easier doing it on the right. Because it's your left side that's weak, okay? And your right side picks up. And what happens when you walk, you have to lift up your hip to swing your leg through. If you can't lift up your hip, you kind of do this thing. Okay, a stroke gait. So hip hikers, and we have all these, funny, my daughter did them all, and they're all on exercise sheets now, and Melissa coordinated and wrote all the little intros, so if you don't understand it, this is like one of the single best exercises you can do, okay? I'm glad to help all you guys learn how to do this, where you're gonna lift your hip up and down. You do 5 on this side, and then you switch over, and you do 5 on this side.
How many times a day?
I would do it once a day, 2 sets of 5. Start out slow because these are muscles and areas that you don't exercise that much. You can easily overdo it. Okay. The one person I would say not to do it, if you have pain running down your legs from a disc injury, this often will aggravate. Okay. So, but for the most part, most people that have chronic just lower back pain in your butt area, in your lower back, it's got to do with your sacroiliac joints. The other exercise that we do is we have to kind of reprogram things. And when we walk, we kind of, our arms kind of swing with our legs. A lot of us forget that. So this, Melissa, if you want to pop up here. Put your shoes off. Okay. This is what we call our marching exercise. And we start out by first moving, let's just do one arm, okay? And when that comes down, the other arm starts up, and then cross at the 50-yard line back and forth, okay? So she has her thumbs up, that's so you don't jam your shoulders, okay? Because your shoulder, you don't want your hands flat, you want them parallel on the side of your body. Okay. That's part 1. Part 2 is to slide your leg up, and as that one slides down, this one goes up, and you need to cross at the 50-yard line. Okay. Now, this is the exercise. You gotta walk and chew gum at the same time. Okay. So we do right arm, left leg, and when that starts down, the other goes up. You can do this before you get out of bed in the morning. Okay, the easiest place to do it is lying on bed. You need to have your shoes off, your feet need to slide along the ground. Okay? If you do, oftentimes it comes back and it's like this. Okay, those are completely different muscles that you're using. Okay, this is a neuroprogramming exercise. It's not so much a strengthening exercise as it is restore the normal movement. So all your spine is working together with your arms and your legs. So you count to 20. So you get 10 on each side. So you start out doing hip hikers and marching on your back. Then, got that going for a week, doing pretty good, no problems. We add in the next one, that's a little more difficult. On your hands and knees. Okay. So we're going to do the same movement, taking the left leg back and the right arm out, and you keep the leg nice and long, parallel to the ground. You bring that one in, and you take the other one out. Now what's going to happen is that you're going to, just keep going, she has this here and her leg goes down, say that stays right there. Okay? Now when she does the other side, then she kind of rolls this way a little bit. That's her weak side. Okay, we know that. So what you want to think of is you got a plate of spaghetti here, because I'm Italian, right? And you don't want to dump it. So you don't roll to the side. Okay? You try and keep your back nice and flat. No fire hydrants where your leg is coming up in the air. Okay? No dog peeing stuff. Okay?
No warning.
Back nice and flat, and you just go nice and slow, and you maybe hold it for a second or two at the end. Okay. Last one, lay flat on your stomach. This is the most advanced one. Okay, arms out in front. And we're gonna lift up the left arm and the right leg. Hold that, back down, do the opposite, and you do 10 or 20 of those. Okay? This is the third week. You add this one. There's your fourth week. You just can't, you don't want to hyperextend your back. So don't, again, the leg just comes up straight as far as it goes, that's it. Okay, it comes up any higher, you gotta roll. So those are your basic back exercises. Now, let's have you turn over on your, well, you can sit outside, we'll talk about it a little bit. One of the hardest things on your lower back is what? Of all the postures that you do in a day, what's,
Crossing
no,
your
that's
legs.
one. Cross your legs, okay, that's good. What are you doing when you cross your legs? Sitting. Alright. When you sit, you double the pressure on your lower back. Okay? When you sit and lean forward, like you're at the computer, you triple the pressure on your last disc. Okay? So you need to take a break from sitting now and then and get up and walk around. Okay? But sitting is the hardest thing on your lower back. Not only does it make your butt spread, but it makes your pelvis spread. Okay? That's why driving long distances, you go to get out of the car and go, oh my God, we have to straighten up. So walk a little bit, pigeon toe your knees, up and down, realign your sacroiliac joints. Sitting is the worst thing you can do for your back. One of the reasons moving up the spine between each vertebrae, we have discs. Discs are primarily made of water and protein. Okay. So what happens when you sit is you increase the pressure on the disc. And that causes it to collapse and squeezes the water out of it. Right? So in order to rehydrate them, one of the problems with discs is they don't have really good blood supplies. And blood kind of brings all the nutrients and everything in there. So what we need to do is we need to pump them to get the fluid back in there. The easiest way to do that is to get one of these exercise balls that you can get at any Academy Sports, Target, anywhere. Make sure, don't buy the cheapest one, buy the one that's a little bit more expensive, okay? It's called an SDS, slow deflating system, all right? Because if you buy the cheap one and it pops just like a balloon, and your butt is on the ground instantly. And you can herniate a disc, you can fracture your hip, you can hurt yourself. The slow deflating system gets a leak in it like your tire and lets the air out slowly. But I've seen these things pop and they explode. So spend the extra $10 and get the SDI. I mean, all in all, a good one is maybe $20, that much. So what you can do is you get one of these exercise balls and you sit on it. Okay, yes, they come in different heights. They come in 55 centimeters, 65 centimeters, and 75 centimeters. Most people are, most people are 55 or 65, okay? And what you want is when you sit on it, you have a kind of a 90-degree angle at your knee and your hip. You don't want you to be too low, and you don't want to be too high. If you're going to err high, don't err low. Because one of the other things that really aggravates your lower back is sitting in something that's soft, okay? If your butt gets below your knees, your sacroiliac joints flare open, okay? And they're going to go out of alignment. That's why the couch is terrible, okay? Anything that's soft. If you're having a back problem, sitting in a firm chair like this is usually a little bit more comfortable.
And they actually make chairs that are those balls.
Yes, you can have a chair and the ball fits right in it, okay? I'm not sure how good that is to sit in all day long.
I have one I use when I'm quilting that
Mhm.
looks like a blob and you sit down
Right.
and
What we want to do with the ball is we want to cause intermittent compression of your discs. So just by bouncing on it, I'm doing this to my disc.
And that's
So-
better than the trampoline.
Yeah. Trampoline is a little bit more for just whole general lymphatic circulation, okay? But here, by sitting on my butt, I'm really focusing on the discs in my lumbar spine. By intermittently compressing them, I'm pumping blood flow through them, so I'm getting healthier, I'm rehydrating them. You know, you hear that, you know, you're a quarter or a half inch shorter at the end of the day than you are at the beginning of the day?
flutter.
Because your discs decrease their height, they dehydrate. Okay? So if you ever have to pass a height test, please
Bounce off.
do, okay? You'll like go first thing in the morning, okay, or bounce on the ball. But you just kind of sit on one of these and you bounce, and I kind of do the sign of the cross routine. I slide forward a little bit and bounce. I slide back, do a little jockey stance there where you stick your butt out, bounce that way, move your feet shoulder width apart, slide to one side, notice I'm keeping my spine straight up and down, slide to the other side. So I'm getting like all four corners of the disc, right? And the facet joints, I talked about those joints that fit together. Well, joints of your body are self-lubricating. What that means is in order for them to lubricate themselves, they have to move. Okay, and that's what gets the fluid coming in there, and that's what prevents them from drying out.
I always heard that, especially when driving and stuff, that you should have your knees higher than yours.
No.
So I read it wrong.
Yeah, you like try and elevate your seat as much as you can. One of the things you want to do when you're driving is get close as you can so there's some bend in your legs. You don't want your legs straight out.
Maybe that was
Yeah, if you have your legs straight out, all right, that takes all the slack out of your sciatic nerve. Everybody, you've heard of sciatic, right? Sciatic nerve is the largest nerve in your body. It controls 2/3 of your legs. It comes out through the bottom of your sacroiliac joints and through your butt muscles and down the back of your legs, about the size of my thumb. When I'm sitting and I flex forward, I'm taking slack out of it, okay? If I have my leg all the way out straight, I'm taking slack out the other end. So I'm kind of pulling on this nerve all the time. So you need a little bit of slack. Well, sit up straight and bend your knees a little bit. Okay? Elevate your seat. Leaning back is not really good for your back. Okay? Because when our side view of our vertebrae, okay, and we have this joint here, that's our facet joint, and the other one comes up from the next vertebrae down below, and they fit together. The big square part of the vertebrae, okay, is where all the weight is supposed to be, sitting on the big bone and on the discs. The facet joint is what guides the movement, okay? So it's not made to bear weight, but it has the most nerve endings, okay? There's not a lot of nerves up here in the front because it doesn't have a job. Nerves have to tell your brain where you're at. So as you start to get that big stomach or weak abdominal muscles, and you start leaning back to counterbalance that, all your weight then gets on the facet joints. And that's where it's not made, and that's where you're going to wear out, that's where the arthritis sets in, and then between each vertebrae is a hole that the nerve comes out. Half of the hole formed by the top vertebrae and the other half formed by the bottom vertebrae. Well, if those joints start to get wear on them, the bone, you get spurs and you get bony enlargement, right? Just like a callus on your hand from too much rubbing. Well, that closes that hole down. Okay, it's called the intervertebral foramen. That's where the nerve comes out. And that's often where you got pain running down your leg. Okay? Also, where this hole is where the disc is. So when the disc herniates, there's all these big ligaments on the side of the vertebrae and in the front of the vertebrae, and so when the disc herniates, it's not going to go through the ligament. It goes to where there's a hole in the ligament, which happens to be right out there where the nerve comes in. So that's where the disc bulges. Okay? A bulge, you've heard of disc bulges and disc herniations? A bulge is like a bubble on your bicycle tire. Okay? The disc hasn't torn and the material hasn't come out. Right? When it tears and the inside material or jelly shoots out, that's a disc herniation. Those often don't heal themselves. Those often require surgery. However, most of them will heal and your body will compensate with time. Okay? Bouncing on the ball helps to create a pressure that draws that back in. Those of you who've been in the office and on the table that splits in half and goes up and down, what that does is pump the discs and creates a negative pressure to help draw that material back in. And then your body will kind of patch it with some scar tissue and heal it up. Okay? Occasionally, what happens is a piece of that material breaks off and gets wedged in that hole, and that's called the disc fragment. Okay? And those 99% of the time requires surgery. Okay? There is nothing really going to. Sometimes, usually whenever I see a disc fragment, okay, I'm not big on surgery, but that's a microsurgery. They don't do a fusion. Right? They usually just go in there like a knee arthroscopy with a couple of holes and just suck that piece right out of there. And it's like a miracle. Because if that piece sits on the nerve for too long a time, the nerve will die. So there's only one reason that you would have back surgery. You don't have back surgery for pain. Okay? Never have it for just pain. You have to be losing motor strength. Your foot has to start dropping. You can't pull your foot up. Your leg gives out on you. You start to lose motor strength. Because when a nerve is made, you have the inner portion, that's our green. And then we have the outer portion of the nerve. Okay. The blue is the sensory portion. Okay? That's what gives you sensation. You know, your leg falls asleep, you got tingling, you got pain shooting down there. That's the sensory portion. So that means there's a little bit of pressure on that nerve. Okay? If there's a lot of pressure on that nerve, it starts to hit the motor portion of it. Okay? And you know, you have foot drop. You know, we've seen people with that where they walk and their foot slaps the ground, or they can no longer pull it up. Okay? Or their knee starts buckling, giving out. That's when the motor portion has become involved. And that pretty much needs surgical correction, or else you're going to lose that nerve and die. Okay? You're going to lose the use of your leg. Right? However, talking about back surgery, study after study after study now shows that exercise, okay, losing some weight, practicing good posture, in the long run will help far more back problems than surgery will. What happens in surgery is they take out the disc and they fill this in with bone chips and they get some metal cages around here and some rods and screws and they lock that sucker together so it can't move. Okay? And they put a spacer in there to hold it open so that the nerve hole stays wide enough. However, when your body was designed, okay, these 5 vertebrae all 20 degrees, those 5 vertebrae are each going to move 4 degrees. Okay? So now, if I take these 2 guys out of the equation, these other 3 guys, when I move 20 degrees, well, they got to move 6.5 degrees each. Right? So they're not designed to do that extra move. So what's going to happen 2, 3, 4 years down the road? You're going to wear out this disc. And you're going to have to go in there and use it again. Right? And then the next one goes in 4 or 5 years. And they know this. Okay? They plan this. Right? They won't tell you this unless you ask. What's the chances that that's going to affect the next disc above in a few years? Well, it's probably at least 50%. Right? However, what happens is we all want instant gratification. I'm in pain. I want this pain to go away. I can get that pain to go away. Well, no. Okay? Out of every 100 back surgeries, this amazed me. Okay, when I saw this study, and this is out of Spine, which is like the New England Journal of Medicine. Okay, it's the magazine for it's the scientific magazine for the back. Out of every 100 back surgeries, just get to it. I had a right bullet. Out of every 100 back surgeries, okay, and it blows my mind how they come up with this, but 1.5 people die. Well, half a person died. Okay? Out of every 100 back surgeries, 1.5 people are not coming home. Okay?
But is that general surgery or just?
That's back surgery. Okay? 34% have permanent complications. Okay? That means they nick one of the nerves and you're wearing a diaper the rest of your life. Okay? You now can't feel below your knee. You know, you threw a blood clot and had a stroke. Right? I mean, there's a lot of things that can happen when you go for back surgery. 76% have complications that require additional hospital stay. Okay? So maybe 40% have a good outcome. We'll give them that much. Okay? That's not real good if you're in the 60% that doesn't have a good outcome. So you want to try everything possible first. You want to talk to somebody like me who doesn't do surgery, okay? Or you want to go to a surgeon that doesn't need work, okay?
Who's good?
Who's good, who's got a great reputation, all right? I have a friend at the University of Miami. He is the number 1 back surgeon in the world. You cannot even get an appointment with him until you send in your MRI and your EMGs, and he will not see you for pain. If you're having motor problems, he will consult, and he will possibly do surgery. Okay? His name is Barth Green. He founded the Miami Project to Cure Paralysis. He is the neurosurgeon. Okay? He invented a technique about 6 or 7 years ago that stopped when you fracture your spine and you become paralyzed from it. What happens is that part of your spinal cord tears, and when cells tear, the chemicals that are inside of them come out, and so the chemicals that are inside the cell will tear the next cell. Okay, so you get this chain reaction where the chemicals that actually ruptured in the first cell start eating the next cell, and that eats all the way through your spinal cord. Okay? So he developed this technique that where if they lower your body temperature, it stops it. Okay? So there was a football player about 5, 6 years ago. It was a New England Patriot game, and he broke his neck. And the orthopedic surgeon on the field had read this paper or saw the seminar or whatever, and actually had the chemicals in an IV bag to be able to lower the body temperature. And he immediately did it on the field and lowered the guy's body temperature, and he did not become paralyzed.
Mm.
Okay? A lot of times paralysis occurs because the swelling is so bad. You know, you break a leg and it swells up, or an arm. Well, you break your back, okay, it bleeds. Blood is made inside the bones. And that swelling compresses, just like we talked about there, where it compresses the nerve, that's what causes the paralysis. And so now, that a lot of people are safe from that. They immediately do a decompression, they relieve the pressure, and so they don't know if you're going to become paralyzed. Those they don't know, and then all of a sudden they walk out and they're okay. So it's really important, but that's a little bit outside the scope of it. However, like I said, when you have a disc fragment where a piece comes off, okay, that's something that's a microscopic surgery. They don't do a fusion. It's called like a discectomy. Okay, you may have heard that term, and that's where they just remove a piece of it. But exercise, diet, nutrition, okay, are all going to do much more for you in the long run than any back surgery. Back surgery might give you a quick fix, but it isn't really going to fix anything long term. Strength training, back exercise training will do more. You just got to realize that it might be a couple months. What's a couple months when you got another 30 years to live? Okay? Looking ahead, time is long. Looking back, time is short. Right? So, oh man, I gotta be this way for 2 months. Yeah, well, if you're dead, you'd gladly take it with 2 months of pain. Right? Or if, okay. We're gonna go over the exercises more in a minute. Let's talk about the chemical problems of back pain. When you have irritating chemicals in your body, okay, inflammatory chemicals, we kind of talked about this in some other classes, those are going to irritate the nerves. Okay? So a lot of chronic inflammation is what's causing your pain, not so much a mechanical problem, as much as your diet. Okay? And we work real hard to try and get you to clean it up, right? Get away from the chemicals in the processed food. One of the biggest causes of back pain that I see in the office is kidney stress. Okay? I just had one of my patients who I see about once a year, and she has sacroiliac problems, and it starts hurting, and it's usually after vacuuming or gardening or doing some repetitive movement. And a long time, a couple years ago, I figured out that it was basically one, she was calcium deficient, the ligaments were weak, and we put her on some enzymes to correct that, and I found that it's her kidney. Okay? And any time that an organ or a system in your body is stressed, it causes muscle contraction. Okay? And if those muscles are around your spine, wherever the nerve, let me back up a second, let me put this. We have our spine. And coming out of our spine, we have a nerve. And that nerve goes to your kidney. And your kidney is under stress because you eat too many carbohydrates and sugars and things, and that's where your kidney has to do all its work. Eat too much processed food. All right. And so when your kidney's under stress, it sends a message back to your spine, which eventually goes up to your brain and says, hey, I'm having a hard time down here. Can you help me out? And so what it does is it causes the muscles to contract. It causes them to contract around your spine. And that's going to pull your vertebrae out of alignment. And that misalignment is going to cause the joints to wear out. It may cause the disc to wear out and more pressure on one side. Right? So then your trusty orthopedic surgeon or chiropractor comes in here and fixes this. It keeps coming back. Okay? You have chronic lower back pain. That's why people had to go to chiropractors forever. Okay? Or it was, one surgery after the other, or pain medicine constantly. You never get off this stuff. It's because you're not getting to the cause of it. And one of the nerves that comes from the kidney comes down here, and I can draw this well enough. Here's our fifth vertebrae, okay? And that sits between in the valley right down here below your hip bones. And it's got a ligament on each side called the iliolumbar ligament. Okay? And that holds your fifth lumbar in place. Well, the same nerve that goes to the kidney comes down here and ends up going to the iliolumbar ligament. So if that electrical pathway has interference in it, or it's not working right, your brain's sending all these electrical impulses down here to this ligament. And so that ligament tightens, okay? Because everything in the body in response to stress tightens, okay? When you get tense or scared, what happens? You get really loose? No, you get tight. Okay? So what happens is it then pulls that vertebrae out of alignment and causes it to pinch the nerves. One of the things you may have heard about is called spinal stenosis. Right? Ever heard that one? All right. So all your vertebrae stack on top of each other, and there's a hole in there that is where the spinal cord travels to. Okay? Spinal stenosis means that hole got smaller. Well, either the bone got more enlarged and arthritic and that closed down the hole, or one vertebrae moved past the other one. Okay? And that caused that hole to get smaller. The number one cause of spinal stenosis in the lower lumbar vertebrae is that fifth lumbar moving, and it's usually due to kidney stress. Okay? So this patient, she comes in, a couple adjustments, not getting better. I said, Mrs. X, are you still taking your kidney enzymes? No, I ran out and I stopped taking them about 3 months ago. Well, that's when I checked her. I said, well, that's why your lower back won't hold an adjustment. Because I put it back in, and the kidney is stressed, and the nerve impulse is coming down there, and it pulls that vertebrae right out of place. So she took her kidney enzymes, and 2 days later she went back in. My back is so much better. You know, I learned this myself. Okay, most of my chronic lower back pain comes from kidney problems, and as long as I take my kidney enzyme, I don't have lower back pain. And if I do, and one of the classic ways you're going to see, you just can't bend over. Okay, you got to do this. I can tell because when I have to lift up the toilet seat in the middle of the night, I can't bend over and do it. Right? And that's for the kidney, so I make sure I take 3 of them every day. And I'm fine. People who have chronic disc problems, okay, degenerative disc disease, you've heard of it. You know, it's like, geez, I really don't have a stressful job. I didn't ride horses all my life. I haven't had a lot of pounding on my back. I'm not a truck driver, okay? Why did I herniate disc, you know, and then I fixed that one and herniated another one later on? Because your discs exist. Everything in your body has to regenerate, okay? When you're born, you're growing and you're living, your body's constantly making new skin, new heart cells, new lung cells, new disc cells. If you're protein deficient, okay, which is the main thing that discs need to stay strong, your discs become protein deficient. What happens is when the protein starts to come out, water likes to stick to protein. Wherever protein goes, water goes. Okay? So the water starts coming out of your disc. So all of a sudden, you're having this back pain, you go for an MRI, and you got 2 or 3 badly degenerative discs. Well, you really didn't have an occupation that should have caused that. That's a nutritional problem. So in order to get the disc healthy again, one of the things that we add in there is protein. Okay? Because when the disc gets the protein it needs, the water will go back in there and it'll rehydrate. We see discs regenerate themselves. So it comes back to, always comes back to what you eat. Okay? Or what you can digest and absorb. Now people that tend to be protein deficient may eat lots of protein. Okay? But you have to digest it and absorb it and break it down into amino acids. So a lot of your chronic pain has to do with chemical irritation. So, yes?
Can you get too much protein?
Not really. Yeah. You can take hydrolyzed protein, okay? This was like a big thing back in the 80s. There's these protein bottles with hydrolyzed protein in pink ice. That's you can have too much of it. Okay? But for the most part, you need a gram of protein for every 2 pounds of body weight you have per day. Best sources of protein, eggs, fish, okay? Red meat is okay if it's grass-fed. Okay? The reason red meat became inflammatory to people, or inflammatory to your body, is because they started feeding it all corn and soybeans and didn't give it grass anymore. Didn't roam around in the pasture. They stand in a stall and they get fed all kinds of chemical garbage. And so corn and soybeans produce sugar, which is inflammatory to the body. So grass-fed organic beef, okay, if you can raise one in your backyard, okay, split it with a neighbor.
One thing I've been finding out by asking questions, like there's a grass-fed beef store in Asheville, when I went in and talked to them, oh yeah, they're raised on beef grass until the last month, and then they grain feed them.
Then they grain
And it
feed
just-
them to
it
give them
makes
more
the whole
fat,
process-
make it
yeah,
sweeter,
and
and
it changes the essential fatty acids.
exactly.
There's a local guy, Possum Hollow Farm, I think it's called, and he said, oh yeah, I'm finishing mine the last month on grain. I'm like,
Right.
why? But they're selling them as grass-fed
grass-fed.
beef. So you have to ask, what are you finishing them on?
Right. And is it, GMO corn and,
Yeah. If they,
So-
if they use a high protein, like one guy did kudzu, that was good. Or alfalfa, I think is okay.
peanut hay.
Peanut hay, yeah, something that has a little more protein.
Yeah, we got beef from it's a place in South Carolina. It's called My Beck. Mr. Michael and Becky, it's, husband and wife have this farm. They feed them all peanut hay, they're on peanut grass all the time. And it was one of the best beefs I ever tasted. They age it for 17 days and they don't corn feed it. Corn is the worst. But fish, okay? If you get, fish is a good source of protein. If it's wild fish, okay? Farm raised fish, guess what? It's eating corn. Okay? Go to this trout farm and throw some corn in there, boy, they'll kill you for it. Okay, let's show you the exercises, because again, I'm talking too much. Okay, Melissa, hop up here in this exercise, girl. Lay on your back.
You gotta hop.
We talked about with the exercise classes, let me just hear the core, okay? The core is this, alright? And I didn't bring my little roll of paper, but your core is what your arms and legs attach to, okay? So everybody wants to exercise their arms and legs, but they're only as strong as what they attach to, alright? The analogy I always used to use, was my dad was a mechanic, was if you're gonna pick an engine out of a car, you have a block and tackle with a chain, and it goes up to the block, and it got a steel arm, and if you screw it in the drywall, alright, what's gonna happen as soon as you lift up the engine? Well, the chain's not gonna break, and the steel arm's not gonna break, but it's coming right out of the drywall. Right? So it has to be anchored to something strong, and that's your core, and that goes all the way around. So the first way, because all of us are not 17 anymore, we train our abdominal muscles, is what we call pelvic tilt, okay? And you're just contracting your abdominal muscles, rolling your hips up, and you're basically bringing your rib cage and your pelvis closer together. And core muscles are what we call static muscles. They're always on, right? Arm muscles and leg muscles are phasic muscles. They're either on or off, right? So you need to strengthen a static muscle in a holding manner. So what you do is you roll up and you hold 1, 2, 3, and back down. Okay? And then roll up again, 1, 2, 3, back down. You want to increase the difficulty, increase the amount of time that you hold it for. Right? One of the things you're going to do is you're going to squeeze your butt muscles together to lift it up and not use your abdominal muscles. Right? You got to tighten this to bring these to come together. Right? So start out with that one. Then the next one you're going to do is a crunch. Okay? And you cross your arms, cross your chest. And you don't want to put your hands behind your neck, because what we used to do is we used to pull up our neck like this. Okay? And it's going to cause a lot of neck strain. You want to make your stomach muscles lift your shoulder off the ground. So you pick a spot on the ceiling, you look straight up there, and you come up just so your shoulder blades come off the ground. And you come up again, hold, the largest muscle in your body, and it attaches to your first 4 lumbar vertebrae, comes down here through your pelvis and attaches to your legs. So it flexes on here, okay? It lifts your hip, your leg up onto your trunk, all right? Whenever you see somebody, the back goes out and they're like this, that's a psoas muscle spasm, okay? And it hurts, it's bigger than my hand. So you don't want, you've heard this, you strengthen your psoas too much, it pulls your spine out of line. It's not something you need to straighten, it's straightened all the time just by you standing up. So then what we're gonna do is we're gonna work the lower abdominals. Put your hands at your side, cross your ankles, okay, knees out, and you're gonna use your muscles to roll up, pull your butt off the ground, hold 1, 2, 3, back down. Okay? Up and hold 1, 2, 3, back down. A set of 10 of these is plenty. Okay? And breathe. Don't hold your breath. Thank you, Melissa. So the easiest way to not hold your breath is talk. You can't hold your breath if you're talking. So you count 1, 2, 3. Don't 1, 2, 3 in your mind. Say it. And you can't hold your breath. So if you hold your breath, you increase the intra-abdominal pressure, puts more pressure on your disc, puts more pressure on your organs. Alright? So count 1, 2, 3. Now turn over on your stomach. So that kind of takes care of the front. What we're going to do is a hyperextension. Okay? So we're going to lift your shoulders up and back. 1, 2, 3, and back down. Okay? This strengthens your back muscles. Up and hold. 1, 2, 3. Okay. Now, don't worry too much about the sides. They tend to strengthen themselves pretty well. Okay? We did the hip hiker where we're using those muscles. But you got to work on your abs, upper and lower, and your extension. You can progress to doing these on the ball. Okay? All right, listen, you can hop on there. Everybody stand up. All right. So we've been sitting, we haven't been doing much all day. Our backs are kind of stiff, and we talked about basically when you feel pain, it's because of swelling. Okay? So as the joints accumulate with fluid, they expand, all right, and it gets tight and you get sore. So what you're going to do is we're going to squeeze all that fluid out of there. You're going to start from your head down to your butt, 1 vertebrae at a time, leaning backwards. And try and imagine each one of them compressing each other. Okay? Get down there to the bottom. Then we're going to bend forward, but more I want to stretch my spine up to the ceiling. So I'm going to drop my chin down and open up all those joints. Not bending over, just kind of rounding my spine forward. Okay? Then tilt all the way back. Through your neck, through your mid-back, through your lower back, down to the sacrum. Okay? Do that like 3 times. Okay? And really when you come up, try and elongate everything so you get taller. Okay? Push up towards the ceiling. Open those joints up. That will get all the fluid out of there. Remember we talked about their self-lubricating. You got to move them to get them good blood flow through there. Get the oils going again. Okay. Any questions? I see one of the things on here. In yoga, they do what's called cat back. Okay. And then they do, what's that
Camel
one?
and cow.
Yeah.
Camel and cow.
Camel or cow.
Camel and cow.
Okay. And then from there, you slide to this guy. Okay.
Child's pose.
And child pose, just relax, let gravity take over. 2 seconds. Come back up. Drop your head. Push back up towards the ceiling. Drop your abdominals. Bring your head up. Slide right on back. That feels really good. That's what you do at the end of the day before you go to bed. Don't stretch first thing in the morning, okay? Because everything's cold and there's no blood flow going through there, and
But we can march.
we can march because increasing blood flow gets everybody healthier and happier. All right. If So when you warm up for exercise, don't stretch. The worst thing you can do. Pump your muscles, move them, bring your knees up. Okay, go up on your toes, go up on your heels. Make sure you hold on to something so you don't fall backwards.
Trampoline's okay first thing?
Trampoline's okay, but one of the best things to do on a trampoline is just march.
Question
Okay.
about the cat cow, cause I was also taught you do this, and you do this.
Yeah.
And that is again that rotation stuff?
Right, that I wouldn't do. The problems with some of the yoga moves is they're okay if you've been doing them for a while. Okay? When you're just starting out, I see more people get broken. Okay? You gotta take baby steps. Here's what I would say. Okay, the most dangerous thing is the mind remembers but the body doesn't. Yeah, I used to do this all the time. Yeah, 30 years ago.
My husband.
That used to be my ring. Alright. Any last minute questions?
First step.